How does age affect scoliosis? Scoliosis is the development of an unnatural sideways spinal curvature. A scoliotic spine doesn't just bend unnaturally. It also twists from front to back or back to front, making the scoliosis truly a three-dimensional condition. And normally the turn or the rotation is into the concavity of the scoliosis. So if the curve bends this way, the spine will rotate into the concavity. Scoliosis introduces a tremendous amount of uneven forces to the body, and if it happens during growth, it can have a significant effect in the development or normal function of bone development or normal growth development. What ages scoliosis affect are many, many different ages. Scoliosis is not limited to one age group. In fact, scoliosis affects all ages, from infants to elderly and everything in between. Scoliosis is, however, most associated or most diagnosed in the adolescent stage, normally between 10 and 18. The most common age of diagnosis is about 12 to 13 years of age. Patient age is an important factor in scoliosis in terms of what it means in terms of likelihood of progression or rapid progression, and also if it's likely to cause pain. Growth and development is the condition's main trigger for progression. So as kids go through their adolescent growth spurt and they go through puberty, this is what tends to make curves worse or makes curves progress in a rapid or a more aggressive fashion. However, babies or infants can also have scoliosis, and there's two main ways. Scoliosis can be something called congenital scoliosis, and congenital scoliosis is really the only type of scoliosis that we know patients are born with. And what ends up happening is that in utero, one of the bones of the spine doesn't fully develop properly, and it develops into something called a hemivertebra, or a blocked vertebra. And this hemivertebra or blocked vertebra isn't shaped like the other bones. And since it's not shaped like the other bones, it's normally shaped like a half bone or like a triangle, it will cause a curvature to occur right at that stage. And people can have multiple hemivertebras in their spine that can lead to multiple different curvatures. And this is called congenital scoliosis. Now, patients that don't have a deformity in their spine can also have scoliosis prior to 3 years of age, and this is known as infantile scoliosis. Now, infantile scoliosis sometimes, just through growth, can resolve on their own, completely go away, but we really don't know which ones will and which ones won't. So infantile scoliosis can be very challenging because when we're dealing with a younger child, we have limited treatment options, and we also know there's a lot of time of growth and development. And like I mentioned, growth and development is the trigger for progression. So we're dealing with a 1 or a 2-year-old child with a significant scoliosis, knowing we have years and years and years and years of growth left. The curve in terms of managing it can be very, very challenging. So dealing with infantile cases as soon as we see them and dealing with them is really one of the most effective treatment options. In juvenile cases, meaning cases between 3 and 10 years of age, we know this early onset of juvenile scoliosis also has the potential of a lot of progression, meaning untreated, this curve can progress into significant standards. In fact, my rule of thumb is when I deal with juvenile scoliosis, the goal is to reduce it as quickly and as fast as possible, because we know during this growth stage, we know curves can progress. And the bigger these curves progress during the juvenile stage, the bigger curve they walk into the adolescent stage, which is when curves progress the most rapidly, the most fast, because this is when curves are going through, or kids are going through the most fastest progression, because they're going through their fastest growth. In this age group, in the juvenile ages, we can achieve tremendous amount of improvement if patients act proactively. Unfortunately, if curves are diagnosed in this stage, sometimes they can be in the mild category, meaning they can be less than 25 degrees, and traditional treatment options recommend nothing. And they're wasting all this valuable time in trying to reduce a curve during this juvenile stage to make a very significant impact in their adolescent stage. So our goals in juvenile stages is to reduce the curve as much as possible, make it as small as possible, and then try to stabilize it in this very small number and wait for adolescence to occur and see what happens, okay? But we actively try to reduce the curve. Now, adolescence with scoliosis, like I mentioned, is the most common time of diagnosis. And the reason why it's the most common time of diagnosis is because this is when curves progress because patients are growing. And this age group has the highest risk for rapid progression because of puberty. And it's this unpredictable growth spurts is when curves worsen. Now, sometimes patients can get a false sense of security, meaning they could have a scoliosis, they see no progression, and so therefore they're not worried about it, but then they go through a growth spurt and boom, and now the curve progresses very rapidly. The amount of progression that can occur here in a very short time period can be very scary. I've seen curves progress 20 degrees in less than 6 weeks. I've seen curves progress 60 degrees in 6 months, and these are patients with no treatment. So therefore, my recommendation is to be as proactive as possible, because the smaller you keep a curve, the less likely it is to progress during this stage. We know curves less than 25 degrees, only 1 of every 3 will progress to severe during adolescent growth stage. But once you break 25 degrees, it's about 2 of every 3 progress to severe during this growth stage. So small, proactive curve, treating curves proactively, dealing with them small is really the key to treatment here. The main symptom of adolescent scoliosis is posture. It's just what you see. They normally don't have any kind of pain. They normally don't have any kind of discomfort. They have nothing. They only have what you see, meaning asymmetrical rib cage, asymmetrical shoulders, asymmetrical waist, asymmetrical hips. So you want to be checking your children's posture. And if you see any type of posture issue, there's never a normal asymmetrical posture that occurs in children. Adults with scoliosis progress completely different than adolescents. Adolescents have a chance to go through this rapid progression, where adults now completely switch. Once teenagers or once adolescents become adults, meaning fully skeletally mature, their bones are no longer developing rapidly, the chance of rapid progression almost completely stops. Now they go into something called long and slow progression. And this long, slow progression that occurs in the adult stage happens as a result of gravity compressing the spine and affecting the surrounding muscles, tissues, and nerves. Now, as a result of this, as the curve progresses in the adult stage, the scoliosis now starts becoming a very common source of pain. And the number one reason why patients or adult patients are diagnosed with scoliosis is because they feel pain. So theoretically, this is what we believe what occurs. Your curve can progress 50 degrees as a child. It will cause no pain. You hold it at 50 degrees as an adult, you probably will feel nothing, no pain, even though your curve is 50 degrees. However, your curve can progress 25 degrees as a child, and then it progresses from 25 to 30 as an adult. That 5 degrees will hurt because it's compressive, where the progression as a child is elongating and you're growing with it, so the body's adapting. So therefore, treating patients' pain in the adult is normally the number one focus, where in children, the number one focus is trying to prevent the curve from progressing during adolescence. Now, unfortunately, once the curve starts progressing in the adult stage, we know it takes on this snowball type of effect, meaning the curves progress relatively linearly from like young adulthood to about 40 to about 45. And then they start progressing faster once you break 45 years of age, 50 years of age. And we call this cyclic progression. As the curve becomes bigger and as you become older, the curve starts to accelerate its rate of progression. That when we're looking at elderly patients with scoliosis, the curves can start progressing relatively quickly in this stage. Now, what I'm describing is the traditional idiopathic scoliosis or adolescent scoliosis in the adult form, which is by far the most common type of scoliosis. However, there are other types of scoliosis in adult cases. There's something called adult onset scoliosis. Adult onset scoliosis are patients that develop scoliosis in the adult form from one of 2 main reasons. One is traumatic, either traumatic as a result of injury or trauma to the spine or some kind of internal problem, or degenerative scoliosis. Something shifts the spine, causes the spine go through a degenerative phase, which leads to degenerative progression in the adult stage. Now, these 2 types of patients, in addition to all the adolescent cases that were diagnosed, and then in addition to all the adolescent cases that were not diagnosed, makes your largest population of scoliosis patients in elderly. not adolescents. Even though we think of patients with scoliosis as adolescent patients, the most common age group of scoliosis is patients over 60. We think patients over 60 to 70 years of age, about 30% of people have some form of scoliosis. So therefore, scoliosis affects a tremendous amount of people, and treating scoliosis properly in the adult stage can be sometimes more difficult than treating patients as an adolescent, because as patients age with scoliosis, their spine becomes more deteriorated, causes more pain, and they unfortunately don't recover well to surgery. So in adolescence, when scoliosis becomes severe, they recommend surgery, even though that's something that we try to prevent. In elderly patients, when they become severe, they don't even have the option of doing it because they're more likely not going to survive the surgery, and the surgery is going to cause more problems than their scoliosis. So therefore, we recommend, if you're an adult and you know you have scoliosis, even though it's not causing even a tremendous amount of pain at this point, we still recommend being proactive, because what we tend to see is this snowball effect, and as you start getting older in age, it becomes more difficult to treat. So regardless of age, we know scoliosis is a progressive problem, and scoliosis needs to be taken seriously, really in any age group at any time, because treating it proactively is going to lead to a much better outcome. And we also know that treating scoliosis in adults or adolescents, keeping the curve as small as possible, with a complete rehabilitative program that's going to address all the conservative approaches to scoliosis, will provide you the best possible outcome, not only now, but also in the future. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.